Hello and welcome to our Changemaker series, Talk to Dr. Koko, program that gives voice to changemakers in our society. Today we're going to be talking about a very interesting topic that's all over the news right now, which is colorectal cancer, or colon cancer as it's popularly known. And we will be dedicating this episode to the memory of Chadwick Boseman, the Black Panther. I'm your host today, and my name is Dr. Koko. And today we have as our guest an expert on this topic who will be educating us, and that is Dr. Wale Ajumobi. Welcome to the program, Dr. Ajumobi.
Thank you. Thank you for having me.
All right. Um, Before we get started, let's start off by having you tell our viewers a little bit about yourself, professional, personal, whatever you'd like to share.
Yeah, I'm Wale Ajumobi. I'm a board certified gastroenterologist. I practice here in California, US. I did my internal medicine training at Loma Linda University and my GI fellowship at the University of Texas in San Antonio. I've been involved in colorectal cancer prevention and awareness for quite some time. About 6 years ago, I created a website called um, www.bowelprepguide.com to educate people about bowel preparation and colonoscopy. I've been fortunate to have received the American College of Gastroenterology Award for colorectal cancer awareness um, multiple times. And so this is a topic that is very um, near and dear to me. This is a topic that I'm passionate about.
All right. Thank you, Dr. Ajumobi. And let me set the stage for this conversation by kind of, saying that, in Hollywood, I live in California. Hollywood's made us believe that superheroes are indestructible, right? But the sudden announcement of the death of my favorite superhero, Chadwick Boseman, the Black Panther, came as a surprise to many people um, around the world who never knew that he was fighting fictitious, as he was fighting fictitious villain in that movie, Black Panther, he was at the same time, now we know, quietly fighting a real life villain, colon cancer. And since his death, many people have become curious about this disease, and some a little bit worried, and obviously so for this killer cancer, colorectal cancer or colon cancer, as it's commonly known. So let's start off by asking Dr. Jimobi, can you tell us, our viewers, what is colon cancer?
Colon cancer, or better described as colorectal cancer, is cancer that originates from the colon or the rectum. It is the second leading cause of cancer death in the US, and it is also the second leading cause of cancer death in the world, according to the World Health Organization. And so this is an important cancer to recognize.
Wow, second killer in the US and in the world. I didn't even know that because it's not really as popular as breast cancer, lung cancer, and the others. But just to find out that it's second, that makes me curious. Is this on the rise? Did it just get to that position, or has it always been, and there's just not publicity to it until now with the passing of Chadwick Boseman?
Yes, it has always been. It's been the top two, three leading cause of cancer death for quite some time. Um, Unlike breast cancer and skin cancer, it doesn't get the same attention as some of the other cancer, partly because of the embarrassment factor that is associated with colon cancer. Um, some of the symptoms um, that we see in patients with colorectal cancer are symptoms that people don't like to talk about. And so that is why it's not as glamorous, so to speak, as breast cancer.
Okay. So you've talked about the symptoms, but we'll get to that. Why um, or who have the people that are mostly at risk for this cancer? Because Chadwick came as a surprise, but is this breast cancer is more predominant in women, prostate in men? Who's at risk for colorectal cancer or colon cancer?
So anyone with a colon is at risk for colon cancer. If you have a colon, you're at risk for colon cancer. Um, we tend to classify people into two categories. We have the average risk individuals, and then we have the high risk individuals. So the high risk individuals are people with family history of colon polyp, family history of colon cancer, patients with certain genetic disorders, um, patients with history of inflammatory bowel disease, meaning patients with ulcerative colitis or Crohn's disease. These patients are at a higher risk compared to the general population. One may even include African Americans as being at a higher risk for colorectal cancer than other groups, other racial groups.
Let me follow up on a few of those. So you went through a few risk factors, family history, environmental, and some of that, and then you talked about African Americans in particular. Let's start with that because Chadwick was African American. Why is there a uniqueness in terms of, or why are the African Americans at a higher risk than the rest of the population?
You know, I think it has to do with two factors. I believe there are environmental factors that make African Americans more um, prone to having colorectal cancer and dying from it. We may also have a difference in the biology of the cancer. It seems like colorectal cancer may behave differently in African Americans compared to other groups. For instance, we know in the United States that African Americans are 20 times more likely to have colorectal cancer, and they are like 40 times more likely to die from it.
Wow.
And so why do they have more colorectal cancer? We tend to have um, more obesity in African Americans. And so the food we eat, access to healthcare, access to screening, access to medical care, even when you have colorectal cancer. These are some of the factors that contribute to a higher uh, percentage of colorectal cancer in African Americans.
Okay. So it looks like you were mentioning some social determinants of health, like environment and all those things. So it's nothing that is genetic. There's no genetic link to African Americans or anything. Is there a link between the genetics of African Americans and the virus?
No, I mean, not that we've identified. We know we've identified some genes that are associated with colorectal cancer. it's not like African Americans are more likely to have those genes. No,
Yeah.
ones
Okay.
that we've identified. Having said that, when people develop colon cancer or any other kind of cancer, it's usually an interplay between the environment and biology, something in you. But in terms of identifying specific or unique genetic factors in African Americans, we don't have that yet.
Okay. So, and why I asked that is, uh, I work for a company that provides a wellness check for annual wellness check for uh, employees, and they started sending me a few years ago this pickle card for occult test cards and stuff. Um, and I'm not 50 years old yet, but I thought that would be for someone that was much older um, than myself. And but I started getting that and looking into it, and it seems like there's I don't know, some information there that African Americans or Black people need to be screened earlier um, than other people. Why is there a difference, or is there a confusion between that and other people?
Yes, the American College of Gastroenterology was the very first big medical society to say that African Americans should begin screening at age 45 compared to the rest of the population. So most people start screening at age 50. But for African Americans, the American College of Gastroenterology recommend the age of 45. And the reason why they gave that recommendation is based on the statistics that I gave you earlier. One, they are more likely to have the disease. Two, they are more likely to die from the disease. And so that is the justification for the younger age for African Americans. One may say now that the point or the difference may be a mute point, because in 2018, the American Cancer Society said all Americans should start screening at the age of 45. So 2 years ago, the American Cancer Society said all Americans should start at age 45.
Oh, so and while doing the research for this topic, I also found out that in certain circumstances, for certain individuals they recommend screening even at a much younger age. What are those circumstances or factors that would cause a doctor to be worried and make somebody screen at a much younger age?
Yes, so there are some people, if you have certain genetic disorders, you need to start earlier. Um, if you have a family history of colorectal cancer, you need to start earlier. You need to start at the age of 40 or 10 years younger than the affected individual. For people that have Lynch syndrome, and we may talk about it later, you start at the age of 20 to 25 or 10 years younger than the affected individual. If you have history of ulcerative colitis or Crohn's disease, Crohn's colitis, you usually start about 8 to 10 years after the start of the disease. And so if you have a person who was diagnosed with ulcerative colitis at the age of 10 years old, by the time they are 18, they need to be getting colonoscopy regularly between every 1 to 3 years. And so when you start, it's based on your family history, your personal history, if you have certain diseases, or if you have certain genetic disorders.
Okay. So thanks for clarifying that, because I got a little confused between you know, the age of 45 for some, 50 for some, and now, you know, age is related to all these other factors that you talked about, family history, and all the others. And you mentioned the Lynch syndrome. Can you tell us a little bit about that before we kind of move on to, because I'm going to talk about symptoms and signs next to that. What is the Lynch syndrome?
So Lynch syndrome is one of the inheritable form of cancer, colorectal cancer. So colorectal cancer can be inherited,
Okay.
and the two most common forms of inheritable colorectal cancer are Lynch syndrome and familial adenomatous polyposis, otherwise known as FAP or FAP. But the most common is Lynch syndrome. It is estimated that about 3 to 5% of all colorectal cancer are due to Lynch syndrome. And so that is why if we diagnose colorectal cancer at a young age, for instance, in people younger than 50, you know, we tend to want to look for or test for Lynch syndrome. If you have multiple family members with colorectal cancer, we tend to want to look for Lynch syndrome. If you have multiple different cancers across different generations, we want to look for Lynch syndrome. So it's one of those genetic disorders that we can actually diagnose.
Okay. So this gets wow. So should I be worried if someone in my family had colorectal cancer? Does that mean that I have the genes, or should I be running to do this test?
That is an excellent question. Um, Years ago, the answer that I would have given you will have been different. Um, Genetic testing used to be much more expensive. It was hard to get. Now we have several companies that are doing direct to consumer provision of genetic testing, companies like Color, 23andMe. And so the genetic code has been broken. And so it's now easier and cheaper to get genetic tests. We now have a guideline, for instance, that says that all colorectal cancer should be tested for Lynch syndrome. So if anybody has colorectal cancer now and they are being treated, especially in cancer centers, comprehensive cancer centers, we test all of the colorectal cancer for Lynch syndrome. And people with family history of colorectal cancer can actually also get the test done.
Okay, so is that something that, you know, I guess let me put it this way. Is it something that you would recommend that if you have a family history of this, or someone in your family, would you recommend that, you know, people can get this done on their own just to have a peace of mind? Or should they just, you know, do the regular, or wait till when they hit the age for screening and just do all the screening at that time?
I would say that if you can afford it, it's not a bad idea to get a test done. It's if you have, you know, family members with colorectal cancer, particularly family members with colorectal cancer at a young age. There are some online calculators that can help you to estimate your risk for colorectal cancer, where you put in your family history and they are able to suggest or estimate your risk. Again, in the era of direct to consumer marketing of genetic testing, anybody can go to any of these companies that do genetic testing and get the test done.
Okay, so that's really good to know. So if you're watching this and you think that you're at risk, you know, you can do a genetic test on yourself. Probably talk to your doctor to see if that is necessary. I think this is really great information. Thanks for sharing that. Because the idea here is, let's know what the signs are, or let's see how we can get ahead of the disease so we can save some lives here. So, so let's talking about that. We know that, thanks for sharing with us now that we know that we can do a genetic testing to get ahead of it and see if we have a high risk. Hopefully we don't do the testing after we've been diagnosed. But also, so the genetic testing is one thing. What are some of the other things, like, like what are the signs or symptoms that one needs to be worried about, that maybe would be a trigger for you to go see your doctor and say, hey, doctor, I saw A, B, and C. Am I at risk for colon cancer?
I mean, there's an important point I would like to make. Colon cancer can be asymptomatic, meaning you may have colon cancer and not have symptoms,
Okay.
especially early on, because there are times when people come to us for colonoscopy and then we find colon cancer. And they say, oh, I didn't know I have it. So that is why screening is very, very important. Having said that, these are some of the symptoms of colorectal cancer. You may have blood in the stool, or rectal bleeding. You may have a change in your bowel habits. Let's say you used to have a bowel movement every day and now you don't have bowel movement for days. For some people, it may be diarrhea. For some, it may be a change in the caliber of the stool. Abdominal pain, or what we belly pain, some may have, weight loss, and anemia, particularly iron deficiency anemia. These are some of the symptoms and signs of colorectal cancer.
Okay, so you mentioned some things that personally to me are kind of concerning, because I think a lot of Americans or Africans or Black people or white people, everybody's had diarrhea. Everybody, I believe, would have had constipation, and maybe at some point, maybe even blood in the stool, belly pain. Um, these are common things that we run into at some point in our life. Maybe after a party or a sushi or something, you may have one or all of these stuff. So should we run to the doctor? How do we know that this is a normal food poisoning rather than colorectal cancer?
Oh, this is an excellent question. So it's not unusual to have constipation or diarrhea every now and then, maybe from food poisoning. Sometimes when we travel and we change our diet and our environment, some of us tend to be constipated, some may have diarrhea. If these symptoms go away after a few days, that is okay. It's when it's chronic, it's when it's persistent, when the diarrhea is now going on for weeks, or the change in your bowel habits, the constipation has now been going on for weeks. That is when you should seek medical attention. Your doctor will be the best one to say whether you need a colonoscopy in this kind of instance, or whether you need some other kinds of tests.
Okay, so okay, good, because I don't want after this show people to start running to their to their primary care physician saying I may have colon cancer. So if it's ongoing for weeks on end, one or combination of all of this, then go see your doctor.
Yeah.
So if I go there and I see my doctor, what kind of test would they do? I mean, what should I expect for doctor to do to test or confirm that I have colorectal or colon cancer?
Yeah, so I mean, your doctor would be in the best position to sort of look at your past medical history, your family history, your age is very important. So, for instance, if somebody, a teenager, has diarrhea after a party, the assessment is completely different from a 50-something-year-old that all of a sudden develops um, diarrhea that is not going away, especially if that 50-something-year-old has not had a colonoscopy recently. So there are so many factors that your doctor will consider before recommending any test or colonoscopy. Um, for some of these symptoms too, particularly blood in the stool, I want to emphasize that blood in the stool is not something to be trivialized. It's not something, because one of the things we are seeing with young people is that sometimes, they are bleeding and the doctor says, oh, you are young, it's just hemorrhoid. It's just your hemorrhoid. And it may be colorectal cancer. And so blood in the stool, weight loss, anemia, these are symptoms that are very worrisome.
Okay, so you mentioned something that so a friend of mine also in kind of prepping for this, I kind of brought up and actually specifically wanted me to ask and clarify because it's kind of work. Um, you mentioned hemorrhoids, right? And you said sometimes this bleeds, and the doctor, there could be some confusion. Does that mean that hemorrhoid presents a risk of colon cancer, or is it what is the relationship there, if any?
No, there is no link between hemorrhoids and colorectal cancer. Um, Having said that, we shouldn't dismiss blood in the stool as being caused by hemorrhoids. And so if you have persistent rectal bleeding, you should seek medical attention. It's not impossible for an individual to have both hemorrhoid and colorectal cancer at the same time. So hemorrhoid is common. We see it often in patients with constipation, and it doesn't lead to colorectal cancer.
Okay, all right. So if you're out there worried about that, this is good information to know. So let me step back and then go back to you know the testing and diagnosis of this disease. I know, of course, you've talked to us about the link test, which is very helpful to rule out the genetic predisposition. And I know that there's some tests out there, like the fecal card that I talked about earlier on that I got in the mail. What are some of the tests that one can do um, to at least have peace of mind that I'm not at risk, or I'm not currently having this the colon cancer, or at least prevent a situation like you described, where it's like I'm going for my colonoscopy and then they're telling me or someone that somebody has the cancer. What are some of the testing that that can help diagnose this disease?
The good thing about colorectal cancer screening is that we have a lot of options. So we have stool-based tests, and there are 3 tests that are stool-based. One of them is what we call guaic fecal occult blood test. Usually it's 3 cards, and it's just testing for blood in the stool. The second stool test is what we call fecal immunochemical test, or FIT test. That one is just 1 card, and again, is looking for blood in the stool. There is a new test that is being advertised on TV that is called Cologuard. And that test combines the fit test with DNA changes. The other tests that can be done are flexible sigmoidoscopy, even though we rarely do that now in the United States because of colonoscopy. We have CT colonography, or what we call virtual colonoscopy, which is a form of CT scan to look for colon polyps. And of course, we have colonoscopy. Colonoscopy is the gold standard. It is the only test that can prevent colon cancer as well as detect colon cancer.
Okay, so I have two things to ask about, specifically colonoscopy, and thanks for sharing this. This is a good information for people to know. I particularly think that, you know, some of these are convenient, especially the stool card test, the fecal occult blood test, and the FIT test you described. But the colonoscopy being the gold standard, I've heard people talk about how uncomfortable that can be. And I know that in your intro, you talked about your website, bowelprep.com, which I visited, and it's great information there, by the way. So if you're looking for information, you may want to visit www.bowelprep.com to learn more. But I want to ask, being that a lot of people talk about how inconvenient and uncomfortable this colonoscopy preparation especially is, are there options out there? I mean, because to make people want to do this, is there any convenient way around it?
Yes, that is an excellent question. There are options when it comes to the bowel prep. So the traditional bowel prep is like a 4-liter gallon. And it doesn't really taste very good. And so for a lot of people, it's too much volume. Usually a day before the colonoscopy, we ask the patient to be on a clear liquid diet. And for some, that is an inconvenience. There is hunger. You often have to take the day off. On the day of your colonoscopy, you have to get a ride, a driver to take you for the procedure and take you back home. So there are some inconveniences associated with colonoscopy. At the same time, colonoscopy is the one test that can completely look at the entire colon, that can give the doctor the ability to find precancerous polyps and remove them before they go into cancer. The other good thing about colonoscopy is that it gives you a 10-year break. If you're an average individual and you get a colonoscopy and the colonoscopy is normal, your next colonoscopy is in 10 years. So that gives you a long break. Whereas if you are doing the stool test, particularly the guaic FOBT or the FIT test, you have to do it every year. And so sometimes people forget to do it. The other thing is, if you do any of the other tests, the stool test, the CT scan, and they are positive, then you have to get a colonoscopy.
Okay.
So it's better to get a colonoscopy upfront if you can. Like I said, the best test is the one that is done. And so if you're average risk and you can't get to a colonoscopy, at least do the stool test. The one other important thing I want to mention is this, and this has to do with insurance coverage. Because if you have insurance, colonoscopy as well as the other tests are covered. They are preventative tests. So no deductible, no copay. If you do any of the other tests, the stool test, and it's positive, your colonoscopy is no longer a screening test. It's now a diagnostic test. So you're going to have copay and deductible.
Okay.
So this may really matter to you. Again, any test is better than none, but if you do the stool test or you do the CT scan and it's positive, you have to do a colonoscopy. And at that point, your colonoscopy is no longer completely covered, no copay, no deductible. It's now a diagnostic test. So you have to pay your deductible and copay.
So it sounds like the gold standard is the best standard.
Yes.
Okay, so thanks for that. For a lot of us that would, be approaching that colonoscopy period, because it's a good information to know to just go straight for that. But I still have in my head my friend that I had to drive to this a few years ago, and he had this gallon that he was drinking all the day before, and we were younger, and then he was just miserable. And this is 2020. That was a few years ago. Is there any other way to avoid that 4-gallon, non-comfortable tasting liquid that you just described?
There are so many options. We now have bioprep agents that are 2 liters, 1 liter, one that is like 11 ounces. So we have options. You don't have to do the 4-liter gallon. You do not have to do the 4-liter gallon. And even if you have to do the 4-liter gallon, there are tricks to making the experience a little bit better. For instance, if you put the bioprep in the fridge and it's cold, it makes it taste better. If you can use a straw and just put a straw at the back of your throat and just suck it down. You can buy cough drops, candies like house cough drops, and you can suck on it while you drink your prep. It makes the taste better. You can definitely add artificial, taste, flavor enhancers. You can add lemon to your prep. So there's so many things that you can do, even for the large volume drinks, to make the taste or to make the experience better. But to answer your question, in 2020, there are alternatives.
Okay, good to know. I didn't know you could add stuff to it. So if you're listening over there, Dr. Ajumobi has given us some tips and tricks to make the colonoscopy prep drink a little bit better. So let me follow up on something that you said a few minutes ago. You said that colonoscopy is both diagnostic and preventative for the colon cancer, because you can take, while doing the investigation, you can go out and take out the polyps or young polyps that are in the colon. Let me ask, what else can people do to prevent colon cancer? I mean, besides having to get to that point where you're on the table and they're looking at your colon, are there other things we can do to prevent this cancer?
Yes. One of the things that we can do, particularly in the African American community, is to ask about family history. Know your family history. Because when you start your colorectal cancer screening or your colonoscopy, it's based on your family history. Some people have to start earlier if they have a family history of colon cancer. So know your family history. We've talked about screening. And then the third thing, which is quite important, is for us to adopt a healthy lifestyle. So there are some things that have been associated with colorectal cancer. Smoking, tobacco smoking has been linked to colorectal cancer. Obesity is linked to colorectal cancer. Excessive alcohol intake, consumption of red meat, processed food in general. These are things that have been associated with colorectal cancer.
Okay. Oh, so thanks for sharing that. There's a great information. So we know how to prevent it: exercise, eating healthy, know your family history. Oh, let me touch on that a little bit now. That for some people that are listening to us that don't know their family history, either probably they were maybe adopted, or they come from a culture where, like you said, things like colon cancer, or things are just not shared or passed on to individuals. What can those kind of people do?
Yes. So if you don't know your family history, or if you're adopted, the other things that we mentioned are very, very important, meaning your lifestyle, exercise, alcohol in moderation, avoiding these foods that we mentioned, red meat, processed food, and then getting your screening test on time. So those other things are still very, very important.
Okay. All right. So thanks for sharing that. Let's talk about now. We talked about um, the prevention of it. We've talked about signs and symptoms. So we've talked about screening and the testing. So what next? If someone gets diagnosed with colon cancer, what should they expect?
If someone is diagnosed with colorectal cancer, the first thing I want to say is that they are not alone. They are not alone. They shouldn't feel alone. One of the things that you can do is to definitely surround yourself with a support group. You need a team of experts to take care of you. And so that includes the gastroenterologist, the medical oncologist, the colorectal surgeon. So you need a team of experts to guide you as to what to do. There is treatment for colorectal cancer.
Can you tell us a little bit more about those treatments? Are they surgical, medical? I mean, how is it treated? And because why I ask that is I'm still struggling with, Chadwick Boseman, Black Panther. I believe he's got the resources available to beat this disease. Um, Not going into why his case was terminal or why he died, but I just want people listening to kind of be able to figure out how they can prevent you know dying from this disease if they're diagnosed. What are the treatment options for people that are effective and safe?
So the treatment for colorectal cancer is based on the stage of colorectal cancer. So we stage colorectal cancer, it goes from stage 0 to stage 4. So for instance, stage 0 colon cancer is just confined to the wall of the colon, to the innermost wall of the colon. So doing colonoscopy, when I do colonoscopy, I can remove that cancer that is just limited to the wall of the colon. For some people, that is all you need, just the removal of that early stage colon cancer. For a lot of people, though, they need surgery. And so for some, it's just surgery, just to remove that portion of the colon with the cancer. Some people need chemotherapy, and some need radiotherapy or radiation therapy. And so the kind of treatment that you get is based on the stage of the cancer.
So what is the outlook like if God forbid, someone gets a diagnosis today and say, hey, you have stage X cancer? Is it survivable? What is the survival percent risk of dying from this if diagnosed with it?
Yeah, it is survivable. We have so many patients that we still see with colorectal cancer. The survival rate is also based on the stage of the cancer. So for instance, for people with stage 1 or 2 colorectal cancer, the survival is very, very high. Whereas if somebody is coming in with stage 4 colorectal cancer, which has spread to different organs, has spread to the liver, to the lung, then the survival is lower. What I want people to take from this is colon cancer is not only preventable, it is treatable. And your survival rate or your chances of surviving is based on the stage. And this is why early detection is also important. And so when people have these symptoms, let's say, we have an individual that is not up to date with screening, and then they develop symptoms. Go to your doctor as soon as possible, because the earlier you go, the lower the stage of your cancer. You don't want to wait for months and years when the cancer has already spread to different organs. At that time, it may be too late.
This is great, good news. Yeah, especially for those of us that are following the news, and at least it's good to know that not in all cases that colon cancer is terminal or leads to death. So, which kind of leads me to this other question of talking about the news and online. There's a lot of information that's been circulating since last week when the death of Chadwick Boseman was announced, that Black people die more, and you've also talked about that. You said they were 20 times more at risk and 40 times more to die from this cancer. Should Black people be worried?
I mean, we should all be worried. I think it's very important. I think one of the legacy of Chadwick will be raising awareness about colorectal cancer, particularly in the Black community. I think that, we should get screened for colorectal cancer. And when we have the disease, we should seek treatment, and we should seek treatment early. For sure, Black Americans are more likely to have the disease and die from it. And like we said before, this is due to so many reasons. And, some of us are working to reduce the disparity that we see in colorectal cancer.
So you talked about working. So with all that you've done so far in this area, in your body of work in gastroenterology and your practice, what would you like to see happen in this area, in this field, and in with colorectal cancer research in general, and then for patients that will be coming up to you? How do we prevent this from happening? What is the current state of research in this, and what are some of the lessons that have been learned in the past few years?
Yes, so one of the things that I would like to see is universal coverage for colorectal cancer screening. Part of the Affordable Care Act, as part of the act, we have free or no copay, no deductible coverage for cancer screening. We are living in the midst of the COVID-19 pandemic. Some people have lost their jobs. Some people have lost insurance. And so if you don't have insurance, you can't get screened for colorectal cancer, or it becomes very difficult. So I would like to see, or for us to have a society where you have access to healthcare regardless of your income, regardless of your job status. So that is an area we would like to see change. we would also like to see continued funding in research, especially amongst minorities. I think we need more research to understand why are Black people having more colorectal cancer and dying from it. What are the things that we can do to change the statistics? And again, I'm glad that there is an attention, especially in the Black community, to colorectal cancer in the wake of Chadwick's death.
Okay, thank you for that, which makes me wonder, with all that you said in terms of what, not having insurance and all of these other constraints that puts people at risk. If you had the power, the magic wand, to put this colorectal cancer away and win the war against it, what are the things that you would do if you are empowered to solve this problem?
One, universal coverage. Everybody should have insurance. Everybody should have access to insurance. Everybody should have access to preventative tests. I think we should spend money on campaigns to educate people. It would be nice to make sure that some of the social determinants of health, right? Like we talked about, social determinants of health, where people live, access to good food, access to vegetables, access to parks where they can walk and exercise. All of these things are very important. And so in terms of, one of the things that I would like to see happen, universal coverage, universal access to preventative tests and treatment for colorectal cancer.
So thank you. So just in closing, is there anything that you would like to share with our viewers about colon cancer today or their health in general? Any passing words, or at least those that are watching this, what is the biggest takeaway from our conversation today?
Colorectal cancer is one of the leading causes of cancer death, like we mentioned. It is preventable and it is treatable. So I want people to know that it is both preventable and treatable as well. We are beginning to see colorectal cancer in young people. It seems like younger people are more likely to have colorectal cancer than even seniors in their 60s. At least that is what the data and the statistics are showing us. Why is that? Some have speculated that perhaps obesity, the way we eat, we now consume more processed food, we eat less fiber. And so I want people for us to go back to the place where we eat healthy food, we exercise, we keep the weight off, and we get the recommended screening test.
Yeah, thank you. And as you say that, just out of curiosity before we wrap, I was just looking at, the picture of Chad one more time, and I think he passed at 43 or 44 years old. And he didn't even make the cutoff screening age of 45. And makes you wonder how many of people out there are in that same predicament that don't even fit the 45 age. They don't make it to that age of 45 and are dying of the disease. Why is his case different?
Yeah, he was diagnosed at the age of 39. And so he battled the cancer for 4 years. A lot of the amazing work that he did, including Black Panther, the films were done while he had colorectal cancer. And so this really makes him a superhero for one to have done this amazing work while fighting colorectal cancer is just incredible. And so it is so difficult to comprehend what happened to Chadwick. But we see colorectal cancer in young people. In 2020, for instance, it is estimated that about 12% of all colorectal cancer will be diagnosed in people younger than 50.
Wow.
And that is why knowing your family history is so important. So if you know your family history and your first degree relative, if a first degree relative has colorectal cancer, for instance, at the age of 40, you have to start screening at the age of 30. So knowing your family history is very, very important.
Okay, Dr. Ajumobi, sounds like that's the key to this. Knowing your history is very key, so you can decide and determine when to start screening to prevent this cancer. And of course, I guess for all of us that have been watching, also following the advice of Dr. Ajumobi with exercise, eating healthy, and just pretty much doing the right thing and talking to your doctor, things that are helpful. And I'm hoping that and maybe somebody with the powers that be would listen to this and listen to the recommendation of Dr. Ajumobi that, making sure that everybody has access to preventative screening, which requires access to healthcare insurance, are key factors to prevent this factor that he's just said, that there's going to be more diagnoses of younger people younger than 50 in the 2020s. So that said, I want to just wrap by saying thanks for being our guest on the show, Dr. Ajumobi. On our show, Talk to Dr. Koko. This show is meant to give voice to change makers such as yourself in our community, and I hope that you will come back someday to share some more important information with our viewers in the future. So to those of you that are watching, we've come to the end of today's episode. And from me, it's thank you. I am Dr. Koko, and I look forward to you joining us on the next episode. If you have any questions, please post, and you can like or share this podcast and YouTube series with those people that are dear to your family and your life. You may be saving their lives. So from me, Dr. Koko, thank you, Dr. Ajumobi. We hope to see you again, and thank you all for watching. See you on the next episode.